Hello and welcome to another episode of the Trish Sean Show. I'm Trish.
And I'm Sean. We are in Wisconsin for the first time. Loving the Badger State so far. We are excited because we're going to cover a lot of ground today on the Trish and Sean Show.
Yes, indeed. Now for this show, we're going to introduce you to our amazing physician team at the Mercyhealth Orthopedic Institute. We serve patients across the state line in both northern Illinois and southern Wisconsin. And really, this is just another way we're bringing orthopedic care closer to you.
Absolutely. Our highly trained orthopedic and trauma specialists, nurses, and physical therapists all work together to treat all things, including joints, hips, knees, shoulders, sports injuries, muscle, and bone disorders. From the most conservative treatments to the most complex, like trauma, injury, and joint replacement, we can do it all.
Now you know what time it is. It's time to buckle up.
Trish and Sean Show starts now.
Well, hello, I am here with Dr. Mike Angeline. He's an orthopedic surgeon out here at Mercyhealth East, and you cover Janesville.
Correct, yes.
Now, I want to know about the services that you offer. Now, you're known as a shoulder guy, right? So tell me about the services that you offer out here for patients.
Yeah, so I probably do in my practice about 70% shoulder surgery. That includes a realm of not only shoulder replacements, including anatomic replacements and reverse replacements. That's used when the rotator cuff is not intact, but I also deal with sports medicine type injuries, rotator cuff injuries, and shoulder instability issues itself.
Okay, and what sports teams do you work with locally here?
So locally I cover both high schools, Janesville, Craig, and Parker, mainly with football and then any of the other athletes that may get injured during the season, specifically basketball during the winter or any of the spring sports itself. I also cover Beloit College, mainly covering the football team during the fall, but each week, every Monday, I go to the training room and see the athletes that may get hurt throughout the season itself. And in the springtime coming up, I also cover the Beloit Snappers, primarily with Dr. Rutherford over at Sports Medicine.
Is it true if you dislocate a shoulder, the rate of it occurring again is higher?
Exactly right. There's a high risk of recurrent instability, usually about 90+% or so. After you get over that 25 age range, it sort of drops down significantly. So you're lucky that you're in your early 30s when you had that first time instability episode.
So is it going to come out again?
So we can try and make it now.
Oh, good.
We'll check your rotator cuff now. So try and push up towards the ceiling for me. So your strength's actually pretty good there. Okay. So there's no rotator cuff issues up on the top. Push out here towards me. Good, and then pull in towards you. So your rotator cuff seems to be fine, so there's no big issues there itself.
Well, thanks so much for your time. I appreciate
it.
Pleasure.
Thanks for stopping by. Thank you.
And
Thank you.
Just bill my insurance. I'm on Mercy Care, so it covers it. I'm good.
We are off. Well, I am here with Dr. Tom Lee. He's an orthopedic surgeon out here at Mercyhealth. You work with a lot of trauma surgeries, right? Trauma patients and also joint replacement. Can you tell me a little bit more about those services specifically?
We deal with traumatic injuries, people who are in car accidents or fall from height. And when they need surgery, we try to work with other surgeons to get the timing right on when to get the bone fixed as best we can. Other part of my practice is elective joint replacement and revision of joint replacements as well. What
is the typical recovery time for somebody who has, say, a total joint replacement?
Most patients are doing fairly well at the 2-week time point, but they're still probably using some sort of a device, a walker or a cane. And then by 6 weeks, I think a lot of people are doing fairly well. Most of the time when I talk to patients about knee replacement, I show them this model and how we do the procedure. We put a metal cap on the end of the bone on both sides, and then there's a plastic piece that goes in the middle, which allows the knee to move smoothly.
What's your philosophy of care? What do you want patients to know about you when they see you?
Yeah, so I view our relationship as a team. It's not a one-way relationship. It's that I serve as a resource for the patients, and we make the decision together.
Yeah, there is a really great orthopedic team here, and we're in all these different pods: Crystal Lake, Woodstock, Janesville, Lake Geneva, Rockford. It's fantastic to see the whole team kind of working together. Well, thank you very much.
Yeah.
Very good to meet you. All right, well, I'm here with Dr. Kevin Klean. He's an orthopedic surgeon here at Mercyhealth, primarily in Janesville, correct?
Yep,
We have a pretty amazing program here at Mercy. Tell me about who you see.
So I am one of the team physicians for the NAHL Janesville Jets.
Okay.
I also work with one of the local high schools in Whitewater. We help and provide services to the Beloit Snappers, and then we are also affiliated with UW Whitewater, which actually Dr. Maldonado is the team physician for,
Sure.
and then Beloit College, who Dr. Angeline and Dr. Rutherford do a lot with, and we all together treat the athletes, for those programs. I'm sports medicine trained, so I do shoulders, hips, knees, but I'm one of the only ones in the area that does hip arthroscopy, which is kind of the new up and coming thing in terms of arthroscopy, where we can scope joints. Now we can, we're getting better and better at treating pathology of the hip.
Now, let's talk about your medical background. Why did you get into orthopedic medicine?
I worked with a private practice when I was in high school, saw what they could do, saw the difference that they can make in people's lives, specifically athletes. And I also like the fact that you could work with your hands, see a problem, and fix it, which is exactly what you do with orthopedic surgery. So I kind of knew going into medical school, this is what I want to do.
I think it covers it. Thank you so much.
No problem.
So good to see you.
Yeah, you
So good
too.
to meet you. All right. Well, that was a great interview with Dr. Klean. We got to go find Sean.
All right, I'm here. Woodstock. All right, made our way over here to Mercyhealth Woodstock, where we're here with Dr. Tarandi. Dr. Tarandi, you do a lot with the hip and knees, sir. Is that correct? As an orthopedic surgeon, what kind of things do you do with people's hips
I
and
do a
knees?
lot of sports medicine. I do joint replacements every Monday.
So what do you love about your job?
The thank you at the end. One of these people, they come in, they're limping, they're hurting, their gait's all thrown off. We kind of put them back together. You got a new joint, you've got a new fixed knee that person's gonna do great. And you know what? You made a difference. And that's what it's all about.
So what's the most common problem? What happens here?
So this is the most common thing that we see is, usually your femur or thigh bone, tibia or shin bone on the meniscus, these little C-shaped pieces of cartilage. Most commonly, somebody will come down, twist their knee, and all of a sudden they either tear their ACL, but more commonly they tear the meniscus, which is the C-shaped piece of cartilage, ends up with a split, and now that bothers you. So we have to figure out, is that an operative tear or something we could manage?
How'd you get into orthopedics?
I love orthopedics. So when I was 10, I broke my arm in a car accident. So this is 1978. So they got my arm out of the door at crowbars because they didn't have the jaws of life. And the thing is, they got my arm out of the door, my arm kind of did one of these things and flopped. And all I remember is my orthopedic surgeon. And I'm like, I want to be that guy. I've got these kids that I've taken care of that were like 8, 10, 12. These kids are all in med school and looking to go. My niece is the same way. So hopeful.
All right, thanks, Dr. Tarandi. Appreciate it.
Thank you, brother.
On to the next. All right, we're here at Mercyhealth Crystal Lake Clinic with Dr. Kurchak, and you are an orthopedic surgeon, sir, correct?
Correct.
So what is your favorite part about your job?
I like seeing all different kinds of ages. It's really fun that way, and I've been in sports my whole life, and to be able to take care of patients that are coming in with the things we like to do on our own, and with my family being involved in sports as well, it's nice to see patients that are active. So my feeling is that, having someone who comes in, whether it's an old patient or a young patient, we can make them get back to things they enjoy in their life.
And you guys could take appointments pretty quick. You do same-day appointments, right?
Yeah, we have a nice feature here with the addition of the x-ray being here all the time. We have a thing called the same-day appointments, or ortho urgent care in a sense, ortho same day. And we try to get as many patients as we can. The goal is, like, if there's an athletic trainer out there that might need to get somebody in and they can't find somebody, we want to be available for them. Or someone has practice late at night and they say, oh shoot, I'm hurt, what can I do? We want to have that availability for them. The important part about that is then they get a plan. They know what's going on. Do I fracture? Do I have a sprain? Do I need other testing? Can I stay out of football? Can I stay out of volleyball? Can I play? Some of those decisions are hard for the athletic trainers to make, and sometimes we don't know till we get further tests. We're trying to be as available as possible. We want to give the opportunity that if someone wants to come in, we're going to do our best to get them in. And I also feel that the personal touch that I offer patients, I try not to, we call it med speak them. I try to get them on a language that they understand, and that when they're coming in to our office, they don't come out with lots of questions and saying, I didn't understand that their understanding of their injury and their understanding of what's going to happen in the future. Sometimes the news we bring them isn't always as what they expect, but I think we can do that in a nice way and in an informative way that they feel that they hopefully would want to come back for new issues or their old issues that they've been dealing with.
Dr. Kurchak, thank you so much.
Thanks a lot.
Now I got to go find Trish.
Well, we made it out here to Mercyhealth Hospital and Medical Center in Walworth. We're so excited to be here. I'm here with Dr. Craig Lyon. He's an orthopedic surgeon out here. Now, when did you start with Mercy?
About 10 years ago now I've been out here. It's been great. This is the only place I've practiced and I've enjoyed it.
What kind of services do you offer out here for patients?
We offer the full spectrum of orthopedic care, so anything from lumps, bumps, broken bones, to advanced arthroscopy procedures, primary hip, knee, shoulder, ankle replacement, revisions of those. So anything you could need that was in the musculoskeletal system, we can take care of here. My goal is to treat them and get them better, whether it's through therapy, injections, surgery, whatever we can do to increase their quality of life and get them back to what they're missing out on. That's our goal.
All right, thank you so much. Now I've got to go find Sean. Let's go see where he is. Sean, what are you doing?
Just waiting for you.
We're not done with the show yet. We gotta go.
Sorry, it's on my phone. Orthopedic Institute. I'm gonna go find my doctors.
All right, well, I am here with Dr. Elizabeth Pickvance. She is a pediatric orthopedic surgeon here at Mercyhealth. Now tell us, as the pediatric orthopedic surgeon here, what kind of patients do you see?
So I see children who have fractures. Some of those fractures involve growth plates, which of course as an adult you don't have anymore. And then I take care of children with special needs such as cerebral palsy and spina bifida. I take care of children that have congenital anomalies that may lead to deformity of extremities. We'll talk about musculoskeletal issues such as muscular dystrophy and difficulties in walking. Children that have club feet. We have children that have hip sockets that are not developed appropriately, and children who have hips that are not in the socket. And then there's a lot of children that have tumors and cancerous growths that are unique to the child's skeletal system. And then children who have infections. Children get juvenile rheumatoid arthritis, which you wouldn't see in an adult patient really. And so there's a whole gambit of diseases and issues that occur in the pediatric skeleton that you won't see in the adult. So some of the children with special needs, of course, grow up to be adults with special needs. And I will continue to see adults with special needs. Even though they're older, they're above the age of 18, we'll still continue to see those patients because they have uniquely pediatric issues.
Okay. Now let's talk about children with special needs. You started a clinic right here in Rockford. Tell us about that.
So the clinic is a great clinic. We have pediatric neurology. We have pediatric physical therapy. We have support from the state and from Easter Seals. Members come, and we also have a person from the bracing community. So everybody gets to see the patients get to see so many healthcare providers at one time, and they get to see us talk amongst ourselves, and the family is a part of this team approach to taking care of their child, and it really helps the families get information from multiple disciplinary areas, and so that as a team we can help manage the child and the family to help the child be as productive as possible. And the families really like it because they see all of their healthcare providers at one time talking to each other and focusing their attention on their child and the special needs of their child.
Can somebody call the clinic here and make an appointment with you? Do they need a referral?
They may need a referral from their PCP, and almost all of the physicians taking care of children in the community know how to get through to me.
Well, thank you so much.
You're welcome.
It's good to talk to you again.
That's my job.
Hi there.
No, that's my job.
I gotta let the professionals do the work, right? Instead of me.
There you go.
Look at that. I'm all fixed up. All playing aside, we're here with a very important person, Dr. Dean Focius. Now, you're an orthopedic surgeon here in Rockford. What do you want your patients to expect from you?
Well, that's always a difficult question because I swam competitively in college, and then after swimming, I had a choice either to become a swim coach or go to medical school. I got into medical school, so I'm a frustrated swim coach. So I sort of bring my athletic experience through and my coaching experience through into the office. So when I talk to patients, I really sort of expect them to do things. So I tell them what the game plan is. So we're basically on the same team together. We work together to try to get the result that they want, which means they have responsibility. So I'm a little bit of a tough coach, and the nurses know it, and they sort of smile and smirk a little bit when I bring patients into the room. But the fact of the matter is, I think the patients respond to that if you talk with them and just really become allies with them rather than telling them what to do. You're basically doing it as a team together.
Okay, so now we're at Mercyhealth Perryville, where patients can come to the Mercyhealth Orthopedic Institute to see Dr. Dirk Liu. What happened was Trish fell in the parking lot, and now she has to get a cast on her arm. She didn't actually fall, but she's going to get a cast on her arm because Dr. Liu is going to show us the process. How you doing, Dr. Liu?
Good, good.
What's the process like?
Well, first I'll put a underlayer on there to protect her skin.
Trish, how are you feeling over there?
I feel pretty confident. I feel confident, Dr. Liu.
I appreciate you volunteering for this because I didn't want to take off my suit coat and then my arm. You're just a trooper.
And it depends on the extremity. If it's a lower extremity, I might have to have an assistant to hold things up, but Trish is pretty good at holding her arm up here, so.
You look like you've done this before.
Yeah, a few times.
I just thought the process was really extensive and messy, and this is easy. I mean...
Trish, how does it feel, actually? I'm curious.
I mean, like, I'm snug in there. Like, my wrist is not moving.
Tell everybody about your military service.
Yeah, I joined the Navy when I was right out of high school. I joined to rescue pilots, and I got recruited to the SEAL program and ended up going to SEAL training and being a SEAL for about 8 years.
What was that experience like?
It was great. There was a lot of camaraderie and teamwork, and I really enjoyed especially the people that I worked with.
Do you feel like there's a lot of teamwork at Mercyhealth?
Absolutely, absolutely. Especially in the OR where things need to happen very quickly. Nurses there are incredible, but our nurses everywhere are also very good. You know, nurses are that way. They care a lot.
So what has been your favorite part of your job as an orthopedic surgeon?
I love taking care of patients. I love seeing people get better. That's really fun.
Walk me through a typical, like, I'm just meeting Dr. Liu for the first time at this Perryville office. What am I going to experience? Do I get met by nurses? Do I come back, and what do you ask me? Stuff like that.
You'd have a nurse that brings you back and checks you in and asks you questions about your past history. And then shortly after that, you'd see me and we'd talk about your issues, and I'd examine you. And you'd probably have some x-rays most often, and we'd go from there.
Okay, so on a scale of 1 to 10, how difficult of a patient was Trish?
I'd give her a 1.
A 1? Aw, Trish. So is her cast set? Does everything look good?
Yeah, it looks good. We can take it off now. It won't cut your skin.
Good job.
There
High
you
five.
go.
I'm still here in the Mercyhealth Orthopedic Institute. I'm just in a kind of a cool corner room where we put our x-rays, and we don't really keep you in the corner, do we,
No.
Dr. Kirpin? But
No.
what is this room used for?
This is our x-ray room, and it's used to do all of the x-rays that are done on patients that come into our office for evaluations. It saves them trips over to the hospital, having to carry films or carry copies of CDs, and it gives us the ability to do the x-rays, and then if we do need extra x-rays or there's something else going on with the patient, we can do it immediately as opposed to having to send them back out to get other studies done and have them come back. It's extremely convenient for the patients. It's extremely convenient for us as physicians.
So what do you love most about your job as an orthopedic surgeon?
Probably my favorite thing about my job is sending people back to the things that they love doing. Getting people back to their things of enjoyment. Getting somebody back out on the tennis court, golf course, back to what they really love doing.
What do you think sets apart our Orthopedic Institute over others?
Any patient that makes an appointment to see us sees the physician. I take direct care of every one of my patients who comes to see me. And we've got all of the support staff that makes the hospital a hospital, is the people who do the day-to-day work on the floor.
Good. Dr. Kirpin, thanks so much for your time. I appreciate it.
pleasure.
I'm going to go find Trish. I've heard that she's not here, though. I've got to go to corporate headquarters to find her. All right, we're back here at our corporate headquarters in Rockford at Mercyhealth Perryville, and I got to tell you, Trish, I am really impressed with the vast array of services we offer in orthopedics.
I know, and the center is brand spanking new. It looks amazing.
You can tell that was a multi-million-dollar investment into our Rockton campus.
For sure. And if I ever need a cast, I know where to go.
I know, in pink and all the colors you want. I wonder if they come in like bubblegum scented.
We'll have to ask him about that.
Maybe that's the next show. Until then, take care.
See you soon.